Hey there, this is Dr. Paul Fernhaber, and it is time for 10 minutes of truth. So I've got another article that I want to talk to you about today. The name of this article is The Effects of Acetaminophen on Risk-Taking, and it's out of a journal called Social, Cognitive, and Affective Neuroscience, September 24th, 2020. So it's about 5 years old. Acetaminophen is generally known as Tylenol. And I've talked about acetaminophen in the past in articles that related acetaminophen intake with pregnant women to the chances of getting autism. And that was out of JAMA Psychiatry. Well, this article is pretty interesting. They start out by talking about a test called the Balloon Analog Risk Task. It's called BART, and it predicts drug and alcohol use, delinquent behavior, and risky sexual behavior. It's a computerized task in which participants inflate balloons to earn money, but each pump risks them losing all the prior earnings. So to measure risk-taking in this study, this test, the Balloon Analog Risk Test, or BART, was used. The authors tested the hypothesis that 1,000 milligrams of acute acetaminophen consumption could influence important judgments and decisions versus the consumption of a placebo. The authors assessed 3 double-blind placebo-controlled studies using 545 healthy young adults, average age of about 20 years old, and measured their risk-taking with the BART test. The participants took the acetaminophen on an empty stomach, and they waited for 45 minutes to make sure that the uptake was sufficient and that the uptake would enter the brain. So acetaminophen is taken by about 23% of the U.S. adult population each week. And research has suggested in the past that acetaminophen's effects extend to the blunting of negative as well as positive affect. Research has demonstrated that acetaminophen's effect on pain and fever reduction extend also to psychological processes. Acetaminophen reduces hurt feelings. Acetaminophen blunts affective reactivity to images. And acetaminophen affects decision making. In this particular test, those that took acetaminophen engaged in significantly more risk than those who took the placebo. There's a greater number of balloon bursts in the acetaminophen condition than the placebo condition. This analysis revealed a significant indirect effect of acetaminophen on risk-taking through risk perception. So, what are the mechanisms of this? Well, acetaminophen inhibits the production of prostaglandins in the brain. The administration of these drugs might provide insight into whether prostaglandins are involved in risk judgments, as well as which enzymes producing prostaglandin, which is COX-1 and COX-2 enzymes, are greatest contributor to the effect. The authors recognize some potential implications for this study. He says many patients in the hospital have acetaminophen in their system when presented with risk information and asked to make potentially life-saving risk assessments, such as whether or not to do an invasive surgery. And what they're saying is that this, or they're at least implying, is that the acetaminophen intake in their body, what they've been given in the hospital, could actually impair their judgment and make them accept riskier surgeries than they normally would. When driving, one is regularly presented with decisions that involve risk perception and assessment. And they're saying acetaminophen might affect this. I think that this is just something to think about, okay? I don't take acetaminophen ever. Probably some of you do out there. And I would, just consider the implications of this study. And at the very least, make sure you take it with, after you on a full stomach, so it diffuses more slowly into your body. But this study indicates that acetaminophen taken on an empty stomach can impair our judgment, and it is something to think about. So this is a little shorter, 10 minutes of truth today. Probably won't go nearly 10 minutes. I hope you enjoyed this study, and I will be back with you next week for another study. This is Dr. Paul Fernhaber here in Lincoln, Nebraska at Lincoln Disc and Nutrition. Our number is 402-488-2220. I'll see you next week.